I can't believe today I finished my second year of residency. It was my last day at work as a PGY2. So tomorrow I will be officially a PGY3. Well, not actually tomorrow because I'm not working tomorrow. So I will be in the clinic on Monday. I start my clinic block. So that's when I will officially be a PGY3. So I want to go back a little bit and I want to talk about something that I actually was thinking to film 1 year ago, but I feel like transition from intern year to senior was tough. Yeah, so that's why I did not film that video. I wanted to talk about some tips, right, for upcoming interns. Tips for somebody who just about to start or have recently started as of next week or will start tomorrow or will start on July 1st, their intern year. Now, feelings are still fresh. I still remember that day. So exactly tomorrow, it will be 2 weeks. I was starting my intern year from night admitting team. So it's a night flow team where we're admitting patients from emergency department. So cap for each intern is no more than 5 patients. And I remember my very first night, I got 5 patients exactly. I know, huh? Very lucky. Black cloud vibes. So I remember, yes, I got 5 patients. It was horrifying experience. It was so scary. I was so nervous, of course. I was with my co-residents, my friends. We had a group of 4 people. It's me, my other co-resident and admitting team, and 2 cross-cover residents. So I remember going to work that day. I packed my lunch. I packed my some books. I was like, I'm going to read something, maybe study during nighttime, because that's the good time to do so. Little did I know that I will actually be working all night long. So just going back and thinking about the emotions I experienced, um, fear. I think I was scared. It was just scary because what if I don't know anything? What if I will be asked something I don't know the answer? So it was like paralyzing fear. Number two, lack of confidence. Again, people around me know some stuff and I don't know anything. So sort of the imposter syndrome. Yeah. And number three, it was also uncertainty. I wasn't sure how it's going to look like. Will I be able to learn, to grow? And I think talking to my friends, we all had kind of similar emotions regardless of the background. I am an international medical graduate, so not too many people in my programs are IMGs. So I always had this imposter syndrome part where I wasn't sure if I know enough since I wasn't trained here. So, but talking to my friends from actually schools in the United States, we all had a similar feelings, right? You feel not ready, you feel not trained enough, things like that. But the things that happened for the past 2 years, and especially through my intern year, that's when you learn a lot and you learn fast. And the amount of growth you experience for the even first year, it's just fascinating. You can learn so much. You advancing yourself. You every day you learning. So actually, the fear. I don't want to dismiss my feelings, but it was actually like not relevant because really you know more than you think. And I'm slowly going to my tip number one or advice number one. It's okay to be afraid, it's okay to be nervous, but you know more than you think. So when I had my first patient, my second patient, and I started thinking through the diagnosis, diff diagnosis, a treatment, you're like, actually, I know that stuff. Actually, I'm not, I can recall it from my school, from my studying for USMLE, so you know more than you think. Listen, you made it already to that point. You made already to the residency. You matched. You went against a huge competition, and you got your spot in the residency. So you know more than you thing. And even if your scores on the steps were not that great or complex, it does not define you as a doctor and immunologist. So you know definitely more than you think. And you will see it as you progress in your intern year. So when you hear this little voice in your head, hey, I don't know, you don't know things, just tell yourself, no, I do. I wouldn't make that far if I don't know anything. Number two, don't be alone. Okay, always try to find support in your colleagues. You guys all will be on the same page. We were all on the same page. Again, same emotions, same feelings. So it's okay to ask for support. And maybe if you are struggling more, if you feel like it's hard to, carry on your own, just talk to your co-residents, co-interns. You guys, again, going through the same emotions, same feelings, same fears. It's very good to have your support group. Number three, people know that you are here to learn. So when you start your intern year, your attendings, your seniors, everybody will know that it's your day one, week one, month one, first 6 months. They all know that you're here brand new and you're here to learn. And I know in my program, it's the culture is like that, but I would hope it's everybody in other places like that as well, where people just support each other. Our seniors will support each other. So we know, everybody knows that you're as an intern, you're here to learn. Okay. Advice number four, it's to learn every day. I know you will want to run the marathon in the day one. You'll try to, um, kind of chaotically study here and there, but I would suggest to choose one topic per day that you want to master for 15 minutes. Listen, first year will be challenging. You'll be working long hours. You'll be working nights. Some of you never worked overnight shifts at the hospital. So it's definitely tough transition. So just be nice to yourself. Just be nice to yourself. Please, if I can go back and give myself one piece of advice, it would be nice to yourself. So just try to master one topic per day for 15 minutes. It can be before the bedtime, it can be in the morning, it can be between the patients, but don't overwhelm yourself. I bought probably half of the library of the medical literature I never used because I didn't have time. And guess what happened? I was beating myself up for not using that. So just be nice to yourself and try to plan, some time for yourself as well. So next step, right? Plan some time for yourself in different forms. Gym, yoga, fitness, meditation, anything. Because a burnout in the medicine is super real. So, again, you will try to run the marathon, but know that you need to take a break, have a stops along the way, and take some time to recover. Not just physically, but also mentally. Because residency, as it is, takes a huge toll even on the strongest individuals I've met, because from your desk and your books and your questions, you go into real life where you are the one now to talk to the patient, to make decisions. Early in your intern year, you might probably will not be making very serious decisions. It all depends on the structure of your program, but later on, you definitely will be making those tough decisions by yourself. So you need to take not just a physical break, but also mental break as well. Remember to work out. I remember in my intern year, I probably went to gym 10 times total for a whole time because it was so overwhelming. But again, if I can go back and say to myself, give advice, I would say, you know what, just go to the gym, work out, find 15, 20 minutes, half an hour. It will be worth it. Another piece of advice I have, it's, work together as a team. Work as a team with your nurses, work as a team with your nursing assistants, with your nutritionist, with your respiratory tech. You have a bunch of resources as an intern, as a resident, right? We just don't know sometimes how to utilize those resources, right? We would be, expecting people to report to us, or even sometimes read our minds, know what we want from them. But you need to create a team, right? It's okay to talk to people, call your respiratory therapist and say, hey, let's just work on weaning this patient off the oxygen, or talk to a nurse and say, hey, listen, here's the plan for this patient for the day. This is our goals. When you create this environment, where you've kind of make the team from the resources you have, your life will be much easier. You'll gain much more respect in the environment you work at. And why we are doing that for a patient. So patient outcomes will be much better. So create the team from your resources. So that's basic stuff I can think about. Definitely I wrote some ideas in my notebook, so I'll be making more and talking more about that. But this is just a general tips which I'm making like quickly because intern year starts tomorrow, so I want you guys to have it out, and I'll definitely film more about that. Myself, I'm happy. I'm almost PGY3. I'm applying for cardiology fellowship, which I'm definitely will be talking more about because it's super exciting times. For me, it was so hard to get to this point, and I had, like people say, up and downs, up and downs. So I was maybe like down, a little bit up and down. So it was a tough road for me. So definitely will keep you updated and keep you posted about that journey. Thank you so much for watching today, and I know you got it. Believe me, I've been there. I know how it feels. You got it. Have a good day.